Okay, now, what an electrocardiogram, which sometimes they call it an ECG, sometimes they call it an EKG. The K is just from the German of cardio, which would be spelled with a K. So an ECG or an EKG, what it's going to do is it's going to record the electrical changes that are occurring through the SA node, the AV node, and through your heart. Okay, so it's recording the electrical changes that are occurring. Okay, so a normal ECG consists of like 3 basic waves. Okay, so it has a P wave, which is when the atria depolarize, a QRS complex, which is when the ventricles depolarize, and then a T wave when the ventricles repolarize. And I'm going to show you, we can do some of these in lab, and I'll show you some EKGs so you can see what they look like. Okay, so ECGs are really looking at the electrical current of the heart. You can determine the health of the heart. You can see how it's operating. So if there's some damage to this system, you're not going to have a normal ECG. Okay, so if we look at this, this is what it looks like. So on the x-axis is time in seconds, and then on the y-axis is millivolts. So we're measuring electrical current. Okay, so in the P wave, what's happening are the atria are depolarizing. Okay, so they're getting an electrical change. Okay, and then there's a little flat spot. Okay, and then the QRS is when the ventricles begin to depolarize. Okay, and then at the T wave, the ventricles repolarize. Okay, now if you look, we have this little key with the contraction. So from the P to the QRS, that's when the atria are contracting. Okay, so this is going to be the signal to tell the atria to contract. Okay, this orange color, okay, at the beginning of the R, okay, that's when the ventricles are going to begin to contract. Okay, so if something is wrong and the electrical impulse is not being conducted, okay, you might be missing a P wave, so your atria aren't going to contract, which you can get away with that. You're not going to feel very good, but you could be all right with that. If something happens and you don't have ventricles contracting, you're going to be in deep doo-doo. Okay, now, whenever the heart contracts, we call that systole. Okay, so systole is contraction. Diastole is when the heart chambers relax. Okay, so systole and diastole. Okay, now, there's 3 phases of the cardiac cycle. So the way it goes, and your book kind of simplifies it, which is fine, which is good. Okay, so there's like a little resting period, which is relaxation period. Okay, then there's going to be atrial systole. Okay, so the atria contract. Okay, then the blood's going to flow through the AV valves and into the ventricles, and then the ventricles are going to contract. Okay, one cardiac cycle takes about 0.8 seconds. So if it takes about 0.8 seconds, that means that your heart rate is 75 beats per minute. Okay, now, when you're listening to someone's heart, the first heart sound that you hear is the lub. So you hear lub dub, lub dub, lub dub. The first heart sounds the lub, and that's when the AV valves actually close and the blood hits them. And then the second sound, the dub, is when the semilunar valves close and the blood hits them. Okay, so here's the cardiac cycle. So here's relaxation. So if you look, you can see when it's relaxed, the blood's entering the atria. Okay, so they're filling up. And the blood is slowly, by gravity, going into the ventricles. Okay, then everything gets the signal to contract. So when the atria contract and go through systole, the blood's going to leave the atria and enter the ventricles. Okay, so those fill up. Okay, so those valves are open, but these valves, the semilunars, are closed. Okay, so after the atria contract, what's going to happen is the ventricles are going to get the message to contract. So the AV valves close, okay, because we don't want the blood to go backwards. AV valves close, pulmonary semilunar valves, or the semilunar valves open. Okay, so the pulmonary one and the aortic one, they open and then the blood can go out to the body. So the ventricles are doing most of the work. Okay, so they're doing all the work getting the blood out. The right ventricle is taking the blood to the lungs. The left ventricle is taking the blood to the body. Okay, so then there's an animation. Okay, now, one way that we look at how efficient your heart is this thing called cardiac output. So they abbreviate it CO. So there's a formula for it. So cardiac output is how much blood your left ventricle ejects into your aorta each minute. And it's measured by this thing called stroke volume. So stroke volume is how much blood is ejected from the ventricle when the ventricle contracts. Okay, so stroke volume times beats per minute gives you cardiac output. Okay, so if this is in liters and this is beats per minute, you can figure out how many liters you're pumping every minute. Okay, so stroke volume is really a measure of how healthy your heart is. So it really depends on how full it is, how strong the contraction is, and whether there's any resistance to pushing the blood out of the heart. Okay, now, where your heart rate is controlled, okay, so I said it was a no-brainer. Okay, so the heart can generate its own rhythm, but your brain ultimately is still connected and it can slow your heart rate down or increase it depending on what's going on. So it's coming, where all the information to your heart is coming from this place called the cardiovascular center, and it's in your medulla oblongata. Okay, so pretty much what it does is if the sympathetic nervous system is turned on, it's going to increase the number of contractions, so increase your heart rate, and it's going to increase the strength of the contraction. Okay, the parasympathetic nervous system is going to slow it down. Okay, now there's all sorts of different things that can affect your heart rate. So things like epinephrine, norepinephrine, if you have an increase of thyroid hormone, all those things are going to increase your heart rate. Okay, different ions can change it. We can talk about that. Okay, age, gender, whether you're fit, whether you're hot, whether you're cold, all those things can influence how fast your heart beats. Okay, so here's just a picture that's trying to show you how your medulla oblongata controls your heart rate. Okay, so here it's a homeostatic system. It's negative feedback. So basically what happens is we have receptors that are called baroreceptors, and they're in your aorta and in this other thing called the carotid artery. And they're going to detect stretch. So if they're stretched, that means you have a lot of blood in there, and you probably need to increase your heart rate. So information is going to come from those baroreceptors. It's going to travel to your medulla oblongata, to this cardiovascular center. And the cardiovascular center is going to send messages back out to the SA node. Okay, so it can travel a couple different ways. Okay, so one way it could travel is if it's sympathetic information, it's going to go out, and it's going to go out and speed it up. Okay, if it's parasympathetic information, it's going to go out the vagus nerve. Okay, and it's going to slow it down. Okay, so there's an animation that explains that. Okay, now there are lots of different heart disorders. Some of the things that you might be familiar with: coronary artery disease. So these are when the arteries that feed the heart itself have a problem, like they might have arteriosclerosis or hardening of the arteries. There might be plaque in there. If there's plaque in there, it reduces the blood flow to the heart, and if the heart muscle doesn't have any blood, the tissue dies. Okay, so that leads to myocardial ischemia or infarction. Okay, so ischemia is a word that's used other places besides the heart, but all it means is that there's a reduced blood flow. So ischemia, myocardial ischemia might be like angina. The blood flow is going down. If somebody has angina and then they feel something's wrong and they take their nitroglycerin, okay, and that's going to open up their blood vessels and it's going to increase the blood flow to the heart. Okay, infarction, an MI, a myocardial infarction, is when the tissue actually dies because there's not enough blood going to it. Okay, and that's it. And my cat's running around trying to get my attention.